On the front lines of the fight to conquer the primary care crisis in New Jersey, you'll find advanced practice nurses and RNs. The New Jersey Healthcare Quality Institute took a much closer look at the value of these nurses at a summit on the failing primary care system earlier this year.
It's been proven that doctors love specialization. So I would say let them be the specialists and hand over the primary care role to advanced practice nurses.
There's no question that nurse practitioners, as an example, are going to be part of the solution. And we, in fact, have been involved in training nurse practitioners. In fact, we have a home visit program that is actively in process of getting started in central New Jersey, and nurse practitioners working alongside family physicians are going to be part of that solution.
How can we meet the needs of the patients? If the patient doesn't speak English, how are we going to make sure that they're treated by a provider that speaks Spanish? If the patient's disabled and can't get to the office, how are we going to build a delivery system that goes out to their house and delivers care where they are?
Some nurses already visit their patients at home, but will tell you much more needs to be done.
I'm still a Band-Aid on a hurting healthcare system.
Kathleen Jackson delivers primary care to her patients and says, especially now, advanced practice nurses can make an incredible difference.
We actually will do the extra hours. We'll go to the patients' homes. You know what I mean? I think it's kind of we're at with the profession that we will take that extra little bit. And we have a holistic perspective on people, which I think is what patients appreciate. They appreciate the fact that we look at who this person is, and not just like what their disease process is, but who they are, what their social needs are, what their other needs might be to try to help take care of their health.
Jackson's patient Mark in South Jersey couldn't agree more.
I don't know how my life would be without that home care. I don't know. I don't know if I had the gumption to get up and go to all these appointments. You know, Kathy is like a coach. You know, she's your cheerleader. It's very encouraging to know that you have to get yourself ready for that person. And yet you also have the opportunity to explain to them some real intimate problems you may be having that you want to do on a clinical level. You know, at home you're in control. You know, you're more relaxed. You're more willing to give up information that may help you.
I think a lot of it for these patients are relationships. A lot of them have, of course, a lot of physical health issues, often lots of social issues, so not many resources, and some mental health issues, sometimes some substance abuse issues. So I think that they've been in the system a bit, and they've had a lot of bumps in life. And I really think that part of it is the trust and the relationship building that makes a difference for them, and maybe feeling cared for, that somebody cares for them, and that I think it does. Like what Mark said, it motivates them to maybe try a little harder for themselves to do better.
The other day, granddaughter was teasing me, and I said, "I'm gonna get you." Yeah, right. She didn't believe me. I jumped up so fast and chased in the other room. She was horrified because she was like, "Wow, Pop's alive again," and she just hugged me, and she said to me, "When's your nurse coming back?" Because she knows that works. She's 5.
I like having the opportunity to get to know people a little bit. I really get to learn, I can really ask them a comprehensive history and get to know their social history, their family history, you know, tell little stories about themselves, so I get to know them. So I actually appreciate that. I appreciate the fact that I can actually know who this person is. I also do really appreciate the fact that I can influence their health, that over time, and I have the time to do that, to keep eking away at their barriers to taking better care of themselves. And so that's rewarding, although it's also, you know, it's sad sometimes.
It's about it, but Kathy has taught me a lot about how to take care of me. I never knew. I always relied on doctors who didn't really care. You know, I hate to compare them to somebody who just wanted to make a paycheck. A lot of times they get caught up in that because of the way the insurance industry works. And I think what Kathy and Dr. Brennan have discovered is that a little bit more time with the patient will give patient a little more time. You know, for someone who's chronically ill like that, you know, it gives them hope. And hope is the greatest medicine ever.